Hi, I'm Linda Stevens. I'm presenting now 4 different types of breath that you can use for birthing. So these are yoga breathing techniques, and they are really helpful in all sorts of different scenarios in birth. So number 1 breath is actually the Ujjayi breath in yoga. So I call this the ocean breath. When used in birthing, just because it sounds like the ocean. And when you're birthing, that lovely imagery of the ocean, the ebb and the flow of contractions, the rise and the fall of those contractions, and riding the waves of the contractions can be really enhanced when you're using this ocean breath. It's very helpful in the first stages of birthing and also in the postnatal period, not just immediate postnatal where you might need to be stitched up, but also the longer postnatal, sort of 6 to 12 weeks after birthing, to help you with your healing. So we want to try and use the diaphragm as much as possible in this breath and really get as much breath as we can into the lungs. We create a slight constriction on the back of the throat, and that constriction makes the diaphragm work harder, and therefore it helps us to elongate the breath, to stretch the breath. Now, we use the back of the nostrils for this breath, and we pull the breath down to the bottom of the lungs and then out underneath the armpits to these intercostal muscles between the ribs, and then up towards the clavicles. So I like to imagine that you're filling a big bowl of water. The breath, like the water, would pour downwards, then out, and then upwards. Now, when you're practicing this breath to start off with, it can be helpful to pretend you're blowing in and out of a paper bag just to create that constriction on the back of the throat, or try pretending you're misting up a mirror like this. So either going or going to create that slight constriction. So if we're going misting up a mirror, then close your mouth but keep that constriction and breathe in and out of your nostrils. So it sounds a bit like this. You're filling the bowl of water. You can really stretch the breath. So ideally, you are breathing slowly over about 5 beats to take you into what's called the parasympathetic nervous system. It's that rest and digest, right, sort of state of being where you're very relaxed. So you're incredibly calming, it's very anchoring, and creating that ocean-like sound gives your mind something to think about, to focus in on, so you're not focused so much on the sensations of your uterus doing her job to get Bubby out. So that's number 1, ocean breathing, or the Ujjayi breath. So number 2 is moving into vocal toning, and I introduce it with the Buzzy Bee breath, or in yoga it's called the Brahmaharya breath. The full breath, you block off your ears and you block off your eyes to create this absolutely insular sensation. And you create a Buzzy Bee breath like this. And the Buzzy Bee sort of sound vibrates around your head, and then you can direct it with your imagination, direct it down your body. But you don't need to block off your ears and eyes. You can just simply breathe in like you do using the ocean breath. So you breathe all the way in through the back of the nostrils, right up, and I like to imagine the breath's coming right up through to the crown of the head. And then Buzzy Bee breath out. So it's a humming sound. It's a and this does many things. 1, it elongates the breath even more, so you go even more into that parasympathetic nervous system. A longer exhalation is telling your mind and your body that you're calm. It creates a low vibration that literally vibrates through the cells of your body as well as Bubba's body and through the amniotic fluid. So it's a very calming and grounding breath for both you and for Bubba. And it's also energizing. So calming and grounding, but incredibly energizing. And I think this is a very powerful breath to use, especially if you're just transferring into hospital and there might suddenly be lights and people and monitors, and if you're able to go into your mammalian brain using postures, getting down on all fours, say, for example, and start to use this breath with your eyes closed, you can very, very quickly ground yourself, calm yourself, and also calm Bubba. So just a few will get you there. And you're pushing the breath down through you, because your diaphragm is working quite hard here to create that sound, to elongate that exhalation. You're getting the deep transverse abdominal muscles to press down onto the uterus, so you're helping the uterus to birth your baby. So the third breath is vocal toning or sounding. It's just sounding. In yoga, or if you think about Tibetan monks, it's chanting. You're creating low vibrational sound, but your mouth's open. And so this is good when you're actually birthing Bubby in that second stage of labor, because it's a lot more powerful, and you're really getting a lot of work through the deep transverse abdominal muscles. You're getting those core muscles to help you to work with the uterus. So it might be a moo or an ah or an e, maybe not so much an e, because we want to make the jaw, the lower jaw, very relaxed. This area and the pelvic floor are deeply related, so we want to keep this area really relaxed. So it might be an ah or an or a moo, something which is quite relaxed here. So it's a breath in, same as before, right up through the crown of your head. Ah, so long, low sound. Wonderful if dad can also create that long, low vibrational sound with you. Now, this sound vibrates through Bubba, and you can direct it like a tuba, like a trumpet or a tuba, down the birth canal. So slightly back and then forward, just like a tuba, or some people like to imagine that flower opening. So using sound to help Bubby go down through that birth canal. Ah, breathing in. Ah, so always low. Women make sound when they're birthing, but the idea is not to make it high, because that's going to make your pelvic floor contract. When you make low vibrational sound, your pelvic floor relaxes. Loose jaw, loose pelvic floor. If you just keep remembering that connection. So that was step 3. Number 4 useful breath is called, in yoga, it's called Sitali breathing. Or I like to call it just a straw breath. It's easier to remember. And if you can curl your tongue like this, brilliant. If you can't, you just do straw breath like this. And you pull the breath in like this. Oh. And this is a useful breath if you are finding that your contractions are coming too hard and too fast, and you need to get on top of things. You need to slow things down. You need to cool off. It's a cooling breath, and what it does is it keeps the diaphragm high. So we're sucking breath in. We're keeping the diaphragm high, so we're not pushing down on the uterus. So Bubby, rather than being pushed down onto the cervix, is being kept off the cervix a little bit. So if we are finding that the contractions are relentless and things are getting too much, it can be helpful to use this Sitali breathing. If you're in an upright position, having your hands underneath your armpits and pushing upwards and keeping your head back like this, it's almost impossible to bear down when you're doing this kind of breathing. It just keeps everything up. So if you are at that pushing stage, but maybe midwife has checked you and you have what's called an anterior lip, where the cervix hasn't quite fully dilated and needs to be assisted in dilation, or if Bubby needs to turn slightly, if there's some reason why your midwife or your doctor is saying try not to push just yet, you might need to just be cooling things off, and this can be helpful. It's quite similar, not quite the same, but a little bit similar to panting out. So I think the most useful thing of all is the vocal toning. Whether it's the full breath out or it's the buzzy breath when you're birthing, because creating sound is an incredible anchor, and it'll also help you with that gate theory of pain. where the brain can't focus on two things majorly at the same time. So if you're creating sound, your brain is focusing on that and not so much on what might be happening with the contractions. So there you are, 4 breath techniques, focusing around the ocean breath, and then that ocean breath turning into either the Buzzy Bee Breath or the full vocal toning, or call it chanting, and then a Sitali breath or a straw breath if you need to hold things back. So I hope you have a wonderful and positive birth experience. Thank you.